Okay.
Today we will be talking about the cardiac pacemaker. I'm Daisy.
I'm Julie.
These are outlined. We will introduce what the pacemaker is, what is the motivation for getting one. We'll also talk about the gold standard test and its advantages and disadvantages.
So artificial pacemaker is an implantable device that maintains sufficient heartbeats when the natural pacemaker does not regularly beat or the pathway is blocked. It is battery operated and the device lasts about 5 to 10 years. So to talk about natural pacemaker, the heart contains sinoatrial node, which is the specialized cells that acts as a natural pacemaker, and it is located on right atrium. It usually generates about 60 to 100 beats per minute, and the impulses travel along the heart, which causes atria and ventricle to contract and pump blood. So the artificial pacemaker contains battery and electronic circuits which controls timing and impulses, and the lead conducts the impulse to the heart and senses whether intrinsic depolarization has taken place. When the depolarization does not take place, the electrical impulse is sent from generator to a pace chamber.
Well, this is our motivation for getting a pacemaker. Every year, more than 250,000 people they have cardiovascular complications which become too complicated. So this pacemaker offers a new lease on life for them. Also, for those who suffer from congestive heart failure, pacemakers are effective at maintaining the activation of the left ventricle. With pacemaker therapy, you can reduce the risk for life-threatening complications that result from the heart failure, and also if you get a pacemaker, it allows the cardiologist to select optimum pacing modes for each individual patient, and which improves the synchronizations of the lower chambers of the heart.
So for the gold standard test, we looked at cardiac catheterization, which examined how well the blood is pumping, but it is invasive because the catheter is inserted into artery and vein through arm or leg, which measures the blood pressure and oxygen level. It also injects dye into the catheter to see whether the blood flow is properly flowing, and this is called coronary angiography or arteriography. Other gold standard tests include CT, cardiac CT and MRI, which is less invasive, but it can be harmful for some patients because cardiac CT uses iodine-based contrast X-ray, and some patients might have allergic to iodine, so it can be harmful.
As I talked before, there's a lot of advantages to a pacemaker. First of all, if the natural systems of your heart begin to fail to regulate heartbeat, then the pacemaker uses electrical impulses to stimulate a faster rate. Also, the procedure to implant a pacemaker is very short, and it's only done under local anesthesia, and patients usually leave within 24 hours of the surgery. This device allows individuals to participate in their daily activities, and most people resume these activities as soon as they fully recover from surgery. It also provides a long battery life, and nowadays the batteries they use are lithium primary batteries, and they use these because they meet the requirements of a long life, low drain current and voltage characteristics, and the shelf life of it is a 10% loss of capacity over 5 years. It usually lasts about 10 years. There are, however, disadvantages to pacemakers, of course, and although less than 5% of patients do suffer from this, the risks can include infection at the site of the surgery, allergies to anesthesia, and some patients do suffer from bruising and swelling. A more extreme risk because of pacemakers do include a collapsed lung, a damage to the blood vessels, and nerves around the location of the pacemaker. There are also external sensitivities that affect how the pacemaker works, and they give it a false signal. So they do tell patients to refrain from putting cell phones over the implantation and going through security systems or passing by power generating equipment, because they pose a hazard to them. And also, you can't get like MRI or other procedures that use electromagnetic waves. Also, there's like patients have to carry around an ID card that identifies them as having a pacemaker, and because like if you get a pacemaker early on in life, you will have to go through a lot of, you have to manage a lot of medical equipment, and you have to go through a lot of like going to the doctor and stuff, and a lot of these like requirements do change with your age, so you're gonna have to like be changing how you take care of your pacemaker and stuff. But pacemaker is very good. And these are
any questions? Did everybody ask the question so far? Huh?
Paul, you haven't asked a question?
You need to ask. Yeah, there's one more group left. You have to ask something at some point, Paul. Okay? So if not this group, next group.
No, can I proceed?
Yeah. Any questions for this group? Everything's going to be on the last group. Who's the last group? Okay, I guess you guys will have a lot of questions then.
What? You guys?